Welcome to week 4 of Intro to Holistic Medicine. This week, we are getting in deeper into case taking and using yourself as your first case study. So first, did you know that your body produces and provides tons of signals that you may or may not be listening to? So this week, we're really going to explore these foundational holistic health principles and helping you move from just symptom management into true healing. So let's summarize some of the key lessons that you're going to learn for this week's journey. But first, we have tons of content for this week that I must share with you. Starting with Tuesday, we'll jump right back into morning flow. I took the morning off this morning. Occasionally I do that, but there are replays available in the playlist. So in case I don't go live, there's tons of replays of our previous classes. That class actually runs 6 a.m. Eastern Standard Time, typically Monday through Friday. Our Intro to Holistic Medicine class, which is our initial class for this week, is going to be on Wednesday at 7 p.m. Eastern Standard Time. So this week, we have lots of great programming that's available. Our morning flows pick back up tomorrow morning. I took the morning off. It was great, relaxing. And so if I don't go live on the morning flow, the replays are available in its own special playlist. So definitely check that out if I don't catch me live. Our first Intro to Holistic Medicine class will be this week, Wednesday at 7 p.m. as usual, Eastern Standard Time. And then this week, actually on Wednesday at 12 p.m. Eastern Standard Time, I will be on a panel with 100 Packs teaching his audience, and hopefully you guys, if you join, all about holistic health. So definitely check that out. Our stress management webinar is going to be on Thursday at 12 p.m. We're doing a lunch and learn, and that'll actually be a weekly lunch and learn spot. So I'll do different topics. So this week will be stress management, and then we'll probably close out the month with a little bit more of emotional health. Then finally, Saturday, we'll deep dive into this week's content on Saturday at 11 a.m. Eastern Standard Time. So definitely join us. All right. So all the content this week is all surrounding specifically case taking, but also understanding how the body works. So remember, we talked about probably in like the first or second week about therapeutic order. And so therapeutic order emphasizes natural interventions first. So we look at things like nutrition, sleep, movement, our foundational pieces, because the CDC actually reports that 80% of chronic diseases can actually be prevented or managed simply with lifestyle modifications. So we're going to really start to prioritize these foundational pieces in our therapeutic order, and then we're going to learn how to build up from there. In that process, we want to understand, is it working? Is our treatment plan working? As we start getting into tracking and as we start getting into our modalities, we need to be able to determine if it's working or not. So Herring's law of cure is what we would use to follow in homeopathy, at least. So Herring's law of cure says that healing begins from the top down, so naturally the mind to the body. Also, it comes from the inside out, so from the deepest organs pushing out. That's why a lot of times you'll have skin reactions or skin eruptions as a response to that. And then also in reverse order of symptoms. So we'll talk about, how we determine that. And remember, experience a temporary symptom increase isn't necessarily a setback. Sometimes it's just the body's natural ability to heal itself revving it up. In fact, NIH actually states that 60 to 70% of holistic patients experience a healing crisis as the body detoxifies and deepens the repair. So we'll talk about that because sometimes those things come up and they can be really confusing. And so you definitely want to understand what's happening with your body. We'll also get into symptom management versus causative treatment. So over 131 million Americans rely on medication. That's a huge number. And so many of these medications, though, as we know, aren't healing the problem. And in fact, they're just masking the symptom. So true holistic healing really involves finding and addressing those root causes, whether they're nutritional, whether they're inflammatory, stress, toxicity, dietary. We really want to get to the bottom of it, because when you begin to heal the cause, naturally the symptom naturally resolves. So you don't have to keep chasing symptoms. That's definitely an excessive use of energy and a mismanagement of energy. I'm exhausted just thinking about it. As we continue on our journey in our digestive, pH, and buffering system, we're going to learn more about our pH and our digestive health really as being the foundation of our health and well-being. In fact, Harvard Medical School indicated that digestive imbalances contribute to 80 to 90% of chronic diseases. So we've known that for as long as we can even talk about, but it's good to have some studies to back it. And so we're going to be tracking our pH levels to help manage inflammation, energy levels, overall health, but specifically we're looking at digestion and we're looking at oxidative stress. So we'll kind of get deeper into that. As you begin to track naturally, we're looking at consistency. So consistency matters, especially in health tracking. In fact, the American Journal of Preventive Medicine found that individuals who consistently track their health or their health metrics have a 42% higher success rate. So tracking your pH levels, your nutrition, your sleep, all these things that we're going to be looking at helps you to understand your body's needs and make informed health decisions, because that's what it's about, right? Is making truly informed decisions so that you can have proper informed consent and you can have patient autonomy. Speaking of which, we will get into some ethics a little bit more. So according to the National Health Interview Survey, 72% of patients want their doctors to discuss holistic options, but many never do. The problem is that your conventional doctor is not trained in this. So ethical holistic care is about training, is about education, formal education. This is why we're doing a course like this, to really understand the depth and the magnitude of holistic care, because it's not just about running a whole bunch of labs, doing a whole bunch of supplements, doing a yoga class. It's so much more than that. It's a mindset, it's a lifestyle, it's a journey, where in ethical holistic care, we really prioritize informed consent, patient autonomy, and responsible decision making, where we guide our patients through a process of healing that's structured and safe. And speaking of which, right, we don't want to be dragging dead bodies with us, no pun intended and no offense taken, but we look at the stages of change. And when we're looking at the stages of change, we look at, am I ready, right? Because we're the patient, but let's say we're looking at another patient. Is this person ready to hear my gospel? Because we love to prophetize to other people. And so first things first, we must take our own advice. What stage of change are we in? Are we in pre-contemplative, meaning where maybe there's a problem? Or are we in denial, thinking everything's fine? Are we in contemplating, thinking there's really something going on and I'm actively seeking? Is there preparation where now I'm actively seeking, I found what I'm looking for and now I need to prepare? And then naturally we have action. Now I'm doing what needs to happen. I maintenance it. And then inevitably there is going to be a relapse. So understanding how to bounce back from relapse as you're tracking, as you're building habits, as you're learning to get well on your holistic health journey. So we want to adopt these strategies to help us to maintain progress as well as motivation. So lots of great things to learn about this week. I'll talk about, a little more in depth of resistance to care and all kinds of different stories and things like that to really make it more of a valuable experience where you get to learn from somebody like myself who's been doing this forever. So again, I'll jump back into Morning Flow Tuesday. If I'm ever not live at 6 a.m. Eastern Standard Time, check out the replay. It's in a playlist, neat, ready for you. All the previous ones are there. And then Intro to Holistic Medicine will resume Wednesday at 7 p.m. Today, I'll have everything over in the core shell, so you'll be able to dig into all the materials and that sort of thing. If you can make it, 100 Packs will be hosting. He's on YouTube as well as TikTok. And so Wednesday at 12 p.m. Eastern Standard Time, we'll be discussing all things holistic health. There'll be other speakers, so that should be really fun. Check us out. Thursday, I have my stress management webinar. It is our lunch and learn for the week. We're going to talk about all the different aspects of stress. It's going to blow your mind because I don't think you really understand how stressed you actually are, unfortunately. But don't worry, I won't leave you there. We'll give you some tools to manage it, especially now. And then Saturday, we'll deep dive back into Intro to Holistic Medicine, really digging in deep and really understanding how we can be a better practitioner, a better patient, whichever role that you choose to take for this week. Some recommended readings for this week continue on. If you haven't read Motivational Interviewing, a great book for that by William Miller and Stephen Rolnick. Also, The pH Miracle, which talks about balancing the diet, reclaiming your health by Robert Young. That's an optional book. It's not a necessary book by any means. Here's another book, Changeology, 5 Steps to Realizing Your Goals and Resolutions, which also has, some good nuggets in there. Atomic Habits, naturally, is an amazing book as well. Really good reviews there. Our weekly discussion question is, which stage of change best describes your current approach to holistic health, and what's one practical step that you can take this week to advance to the next stage? So I'm really looking forward to hearing your responses. If you are not formally registered into the class, you may do so by simply going to the link in my bio, scrolling down to Intro to Holistic Medicine, filling out the form, and then you should get the emails to prompt you into the course shell. So you'll be able to go back, check out previous lessons to get caught up, and it's self-paced, so no pressure, no stress. The course is free. However, if you want a certificate as a prerequisite to moving forward, there is a fee for that. And so it's a $39, I think, a month, or it's $110 for the entire course. The course is a 12-week course broken up into 3 parts. We're almost done with the first part, which is really setting the stage of holistic medicine. We've been working on, suppression, understanding the suppression, understanding, where we are in holistic healthcare politically, as well as just in general, in terms of our practice. Subjective data, objective data. We worked with the nutritional assessment questionnaire. We also have now hopefully been tracking our pH levels, and we're really starting to take a look at that. And so real easy, real gentle. We don't know what these numbers mean quite yet and what we really can do with them, other than knowing that if they're, low, be below 6.8, we want to eat more greenery, more water, more of the natural things to help us heal. And so same thing with urinary. So there is a resource in the guide to tell you all that information. So when you register for the course, you'll get everything. So each of these lessons this week is really designed to empower you to take informed and proactive steps towards your holistic health. And so I'm really excited to talk to you guys in the community, chat with you on the lives, and really support you in your consistency towards your health and your health goals.